Good afternoon. Governor, members of the Illinois General Assembly, ladies and gentlemen, welcome to the new OSF Healthcare Cancer Institute. I want to thank everyone for attending and express my gratitude for the governor and members of the General Assembly for the work they have done to improve the healthcare delivery system in the state of Illinois. While this is the first time the governor has visited our Cancer Institute, it is not the first time he has visited OSF Healthcare. During the pandemic, you were a frequent visitor as we worked hand in hand with the state to address the largest healthcare crisis of our time. And while you are not here today to tackle a crisis like the pandemic, you are here to address another important issue that can have a significant impact on the health of the patients we serve in Illinois. I am talking about the practice of health insurers delaying and denying coverage of needed medical procedures as a means to control cost and limit the exposure of the insurance providers. This practice has real consequences, and we are so appreciative of the General Assembly for doing something about it. We'll focus on two areas specifically about peer-to-peer reviews, as well as a common understanding of the relationship between doctors and the patients they serve. On behalf of the patients we serve, I want to express my thanks for your commitment to addressing this issue. We look forward to working with you to ensure that our patients have access to the care they need. Governor, State of Illinois, Pritzker.
Thank you. Well, thank you very much, Dr. Cruz. Good afternoon, everyone. It's good to see you, and it's great to be here. And it's true, I've never been here before, but you only opened a month ago. So I got here as soon as I could, but what a beautiful facility. You all should be so proud. And I have to say, if I were a patient or had a relative who was a patient or a friend, this would be an environment that I could imagine that they would get the best kind of care. And so I appreciate very much the work that you all do and what you've done to make it welcoming for people. I am very pleased to be here in Peoria at OSF Healthcare Center, Cancer Institute rather, as we work together, all of us, to make progress passing the Healthcare Protection Act. It's a bill that will help us curb predatory insurance practices and empower patients and their doctors. I'm joined today by some stellar partners in this endeavor: our Lieutenant Governor, Juliana Stratton, our representative and the bill's sponsor in the House, Anna Muller, the bill's sponsor in the Senate, Senator Robert Peters, Leader Dave Kaler, Leader Ryan Spain, Representative Bill Houter, Dr. Terry Lynch, and OSF's Nicole Robinson. Last week, the Illinois House passed the Healthcare Protection Act, whose purpose is to make quality care easier to access for patients across Illinois and to increase accountability in insurance companies. For far too long, insurance companies, not doctors, have been free to determine what treatment options patients should have and how quickly they can receive it. With this bill, we're putting power back in the hands of patients and their doctors. The HPA starts out with a focus on utilization management. Too many patients get hit with an unexpected roadblock when they're forced to wait a long time for permission from their insurance provider before they can receive care, all the while dreading the possibility that their request might be denied. Too often, utilization management results in a denial of coverage because insurance companies simply want to boost profits. It's an unhealthy and an unfair system for patients. Utilization management comes in many forms, but it's seen most prominently in prior authorization and in step therapy. Prior authorization forces consumers to get approval from their insurance company before beginning treatment, even after their doctor has deemed the treatment to be medically necessary. And with step therapy, insurance providers can require patients to try and fail, often on a less effective treatment option or medication first before getting the actual care recommended by their own doctor. There's no question that medical professionals are better suited to make recommendations about treatment than insurance company employees. So with this bill, we're requiring insurance companies to use the same treatment to determine medical necessity that doctors do. That way patients get what they need. And we're banning step therapy in Illinois for fully insured and Medicaid plans. The Healthcare Protection Act will also make Illinois the first state to ban prior authorization when it comes to inpatient hospital setting mental health care, because those in crisis should never be forced to navigate difficult insurance policies in the midst of that challenge. When shopping for health care coverage, it's important that insurance companies be transparent about prior authorization so consumers can make informed decisions when purchasing coverage. That's why HPA requires that insurance companies publicly post every treatment that requires prior authorization. We're protecting consumers further by prohibiting insurance companies from selling junk insurance plans, which don't even meet the minimum standards of the Affordable Care Act. By doing so, we're joining a growing number of states, 12 so far, and it's time for Illinois to become the 13th. The second focus of the Healthcare Protection Act is on improving network adequacy. We're setting a standard for care availability, including appointment times and in-network doctors. We often see problems with in-network directories and their listed availability. When a patient goes to look for a provider, the list may show doctors and specialists who no longer accept new patients or aren't any longer in the network, or sometimes don't even exist. Those ghost networks make it even harder for patients to locate care nearby without waiting weeks or months for an appointment. To combat this problem, our bill requires that insurance companies regularly update their provider directories to show the true availability of healthcare providers. And finally, with this bill, we're continuing our effort to prevent insurance companies from gouging their customers by unfairly hiking up their rates. Last year, my partners in the General Assembly and I ended these unfair rate increases for individual policyholders and the small group insurance market. HPA, the bill, requires the same for large group insurance carriers this year. The Healthcare Protection Act is a set of consumer-focused health insurance reforms that will return a sense of autonomy and control to patients and their doctors. We're protecting Illinois families, making it easier and less labyrinthian to navigate the world of healthcare and insurance. I also want to shout out my partners in this fight, the leaders in the General Assembly of this bill. This bill's two outstanding sponsors, Senator Robert Peters and Representative Anna Muller, are working incredibly hard to advocate for Illinois families, and I am truly so grateful for their leadership. This was a bipartisan bill, which also I think should make us all proud that Democrats and Republicans are working together to do the right thing for patients who need help and need a system that is easier to access. When I delivered my budget address in February, I told you that I'd put my shoulder to the wheel to get this done, and I meant it. That's why I'm here, traveling to communities across the state to tell Illinoisans about this legislation. This morning in Belleville and now in Peoria and at other cities throughout the week, we're talking with doctors and patients and consumers with one message. This bill will save lives and lower health care costs for millions of Illinoisans. Together, we will get this bill through the Senate and land it on my desk where I'll proudly sign it, because the people of Illinois deserve reliable and safe access to quality care. With that, I'm proud to introduce the House's chief sponsor of the HPA, who managed, I have to say, the floor debate beautifully the other day, taking questions for a little while, but importantly, making sure people really understood the meaning of this. And I think it's in part because of her leadership that there was bipartisan support for the bill. And the chief sponsor of HPA is Representative Anna Muller. Anna?
Good morning, good afternoon. It's a true pleasure to be with you. I'm This facility is incredible, and congratulations on its opening. Thank you for all that you do for healthcare in this area. We appreciate and uplift the work that our doctors and nurses and leaders in healthcare provide to all of our residents. I am honored to be the chair of the Human Services Committee and the chief sponsor of this bill in the House. But I truly want to thank Governor Pritzker for his tremendous leadership in this area. I'm the sponsor in the House, but I know that this legislation would not be where it's at right now, passing one of our chambers and advancing to the Senate without the incredible leadership and foresight of Governor Pritzker and his administration. He introduced this legislation during the budget address and the State of the State back in February, and it's been an honor to advance this in the House. I want to also recognize and thank my colleagues who are here today, Leader Spain and Representative Howder, who are on the other side of the aisle but showed leadership in supporting this legislation. Rep. Howder came on as an early co-sponsor of this bill, which was a very good sign that we were going to work together to advance this legislation in the House. And I also want to recognize Leader Kaler, who has been a leader in healthcare for many years, and I'm pleased to see that he's here today as well. So this legislation was introduced back in February by Governor Pritzker, but it started its legislative process in the Human Services Committee back in late February, where we held a subject matter hearing to hear from patients, doctors, family members, people affected by the insurance industry and the dysfunction that we have in the insurance industry. And during that testimony, we heard very compelling stories about the struggles that both doctors and patients have faced under current insurance guidelines and under provisions that this bill is intended to address. We heard from a doctor who works in an emergency room talking to us about tragic situations where patients would arrive facing an acute mental health crisis, only to be denied access because of prior authorization requirements or delayed access to care. And we know that when someone is facing a mental health crisis, time is of the essence. And the doctor in our hearing testifying that, once someone leaves, you don't know the chances of them coming back, the chances of them harming themselves or harming someone else escalate greatly. So we ban prior authorization for mental health crisis inpatient care in this legislation to address those situations. We also heard from a gentleman who, as a younger man, purchased one of these short-term junk policies in order to save money and, seemingly was very healthy and felt that, he could buy this short-term plan and it would be adequate. After purchasing the plan, he was diagnosed with MS. And he filed a claim with his insurance company in order to get treatment, only to be told that his MS was a pre-existing condition. He hadn't been diagnosed before, but because he had it before he was diagnosed, they denied coverage. This bill bans those types of plans, which are really just a financial scam and do a lot of harm to those who purchase these plans. These are the real life stories of people who've been affected by the deficiencies and dysfunction in the insurance industry, and these are the tragedies we will prevent from happening in the future once this bill gets passed. So I was very pleased to see this last Thursday that the bill received strong bipartisan support in the House. I'm grateful to my colleagues who voted for it, and I know that we have an amazing sponsor in the Senate with Senator Peters. He's going to bring this across the finish line. in the Senate. We have a little wager going on what the percentage of Republican support will be in the Senate versus in the House, and we'll see how that goes. But I know he's going to do an incredible job getting this through the legislative process and onto the governor's desk. So again, thank you for all that you do. Thank you for hosting us this afternoon. Look forward to a signing ceremony very near in the future. Thank you.
All I know is I think everybody in my chamber should vote for it, so it's unanimous in the Senate. You know, if I gotta compete with Rep. Moeller here. You know, I gotta make sure I deliver. But I'm State Senator Robert Peters of the 13th District, which is a district in Chicago that stretches from downtown Chicago to the Indiana border. And I just want to say, amazing work by the sponsor, Rep. Moeller, on this bill, and as well as the members of the House and the advocates for getting this bipartisan bill out of the House chamber. We are one step closer to bringing comfort and dignity to healthcare patients all over the state. Look, I am no stranger to our healthcare system. I was born hard of hearing. I've had multiple surgeries throughout my life. I've struggled with mental health issues. I have seen these struggles with my friends and family. And in my 20s, I lost one parent to cancer and another one to alcohol abuse due to her coping with her own mental health trauma. Like so many constituents, I know the anxiety and fear that comes with navigating our healthcare system, especially right now as my wife and I are looking to have children in the near future and are doing fertility treatments. It is hard enough trying to navigate the day in and day out of life, whether that is taking care of friends and family and taking care of work and home chores. It is understandable that a bunch of healthcare papers and policies can add even more anxiety to your life. I have a unique district. I mentioned this earlier. It stretches from downtown Chicago through the southeast side to the Indiana border, including very historic working class communities. It is home to large healthcare systems, a public health system, and safety net hospitals. It is also home to people who live across spectrums, particularly across race, class, and gender. But the one thing that is nearly universal is people who have felt pain when it comes to their health insurance. What we are doing here is fighting for you, the everyday Illinoisan, who wants to make sure their loved one, or even themselves, is receiving the best care possible. That when your doctor recommends a treatment, that is the treatment that you get. That when your child is facing a mental health crisis, they get a hospital bed that is filled with love, safety, and comfort. That finding a provider or a plan isn't a guessing game for your well-being and your wallet, and that you aren't fooled by predatory companies masquerading their financial scams as insurance plans. This is a bipartisan bill that's coming to the Senate, and big-time insurance companies are going to do whatever they can to fight against it. They're going to throw the kitchen sink. They're going to do every scare tactic, and they're going to try to make this an inside baseball game. But I want to say that and make it clear that the door is open for both advocates and opposition to be able to give input on this historic bipartisan bill. We are going to bring the people of Illinois to the negotiating table, and we will get this done, and we will continue to make Illinois a healthier and safer place. I'll end on this, and I just want to thank Governor Pritzker. I am honored to sponsor this bill, but I know I'm not alone on this. So many leaders and colleagues, including Leader Kaler here, have worked tirelessly and personally to change and improve healthcare outcomes in the state. When we get this done, it will have been all of us who have been committed to our constituents and ensuring they have the best care possible. I'm proud to introduce a real leader, a mentor, a friend, someone who knows how to get things done, Leader Dave Kaler. Thank you.
Thank you very much, Robert. Well, Governor, welcome to Peoria again. You know, I always like having you here and Lieutenant Governor, because every time you come, you bring good news. I've never known you to bring anything other than good news. So this is good news. And I want to welcome you to the 46th district. This is in the middle of the 46th district. In fact, Nora and I live just down the block. We walked over on Glen Oak and came down here. This is going to be our walking path when it's done here. But this area, you know, Peoria is blessed with having world-class health care. And Governor, you saw some of this exhibited in the new equipment they have, the proton beam. And this is why this is so important. Because health care needs to change. without a doubt, we have the best healthcare in the world. We have the best providers in the world. What we don't have is the best healthcare system. And that's what we're trying to change. I knew this bill was going to be greeted very well because, Governor, when you gave your State of the State address, the first person on their feet was Representative Bill Howder. I saw him. I watched him. And I thought, that's a good sign. That's a good sign because we agree on this issue very much. And that's what we have to change. We have to make sure that we continue our work on this because this is just the first step. This is just the first step. So congratulations, Senator Peters, Representative Mueller. Thank you for carrying this bill. This is an important one. We get across the finish line, and Governor, I look forward to the signing. I want to introduce Leader Ryan Spain, who's also from this area. You didn't have far to go. Do you know this place very well? Ryan Spain.
Well, good afternoon. My name is Ryan Spain, State Representative for the 73rd District. I live here in Peoria. This is a great Peoria day, and Governor, I agree. Whenever we have you with us, we know it's a special time. It certainly is to have you tour the OSF Cancer Institute here today. But it was also a special time last week on Thursday night where you were on the House floor. That's a clue to us as well that big things are happening because you don't typically audit every debate on the House floor, thankfully for you. But we knew that this was an important issue, and talking about the Health Care Protection Act is something that is very significant because improving the health care delivery system is absolutely a bipartisan issue. And I want to give tremendous thanks and appreciation to Representative Mueller. She conducted herself and carried out both the debate and the discussions, negotiations, improvements, and amendments to this bill in really a fantastic and collaborative way. And I'm sure that Senator Peters will continue the same as these negotiations continue to move forward on the Senate side. We think that working together on topics like this make a big difference. And for a community like Peoria, you can tell that healthcare is our largest and most dominant industry. And any improvements that we can make in the healthcare delivery system to empower providers, to create efficiencies, to lift up our patients, it's good for healthcare. It's good for attracting and retaining talent in our communities, and it's good for patients, people, our population retention, and making sure that we can continue to grow our economy throughout all places in the state of Illinois. This is good public policy, and as you heard, one of the people that jumped to his feet most enthusiastically is my colleague, Representative Bill Howder. And it matters that he was immediately enthusiastic, not just because he's a great leader in the Illinois House of Representatives serving as a state rep, because he's a physician. And understanding the critical role that this legislation can play to improve the decisions, the activities, the efficiencies of our providers, of our physicians throughout the state of Illinois is absolutely essential. So please welcome Representative Bill Howder.
Well, thank you, Leader Spain. Good afternoon. My name is Bill Howder. I'm the state representative for the 87th District. The 87th is Morton, Lincoln, and it goes over to Clinton, Illinois. I'm also proud to be a physician. I'm an emergency physician as well as an anesthesiologist here at OSF St. Francis Medical Center for over 20 years now. So I just got done taking care of patients. In fact, I have the shortest trip here. I was just over taking care of patients, got out of my scrubs and came over here. So I want to thank you. I want to thank you, Governor, for being here and for making insurance reform a priority in your administration. As the only physician in the Illinois General Assembly, I feel I can speak for physicians and for healthcare providers and for hospitals. We see this every day. We see the issues every day. We see pre-authorization abuse, inadequate networks, step therapy, denials of care, and we have to deal with the insurance tactics to delay or deny care to patients and delay and deny payments to providers. So I think the governor understands this, and I thank him for putting it in his State of the State address. I did stand up very quickly Did I startle you coming from the other side, from the Republican side?
Don't often get a standing ovation
I think I,
from one guy
yes,
on one side, yeah.
I had some of my buddies texted me, "Are you a Democrat now, Howder?" So I think I pulled a hamstring and, you know, probably wouldn't get pre-authorization to get it looked at. But it just goes to show you that this is not a political issue. This is a issue that is important to physicians, to providers, to hospitals, and especially to patients. I'm proud to be the Republican co-sponsor. I believe the governor's reforms are a good start to further needed reforms. Thank you very much, and I'm proud to introduce my colleague, Dr. Lynch, who's a med-peds physician here at OSF.
Good afternoon. I'm privileged to be here with such a esteemed group of colleagues, and anybody who knows me well knows that I am not a big fan of speaking in front of cameras and behind a podium and a microphone. But when I was asked to do so for the Healthcare Protection Act, of course, my passion for my patients and for the tenets of this act really helped me overcome that nervousness and that dislike of getting behind a podium. I am an academic med-peds physician. So simply stated, I see adults, I see kids, and I teach here. I see my patients here at OSF, and I teach through the University of Illinois College of Medicine, Peoria. And so I function as a hospitalist, and I also go over and teach residents in one of our community partners at Heartland Community Clinic here in Peoria. To tell you that I'm passionate about the opportunities of this act for our patients and for our providers is such so minimalistic. I couldn't convey how exciting an act like this is. Like anybody who goes to med school, I went to med school because I want to help people. I want to take care of people. I don't want to have barriers in that care. There are so many barriers to care, and a lot of these have been hit by this act and some of the things that Representative Mueller already spoke about and everyone speaking here today. I want to be able to see my patient, to explain to my patient what's going to happen next, what the plan of care is. I don't want to have to pause, take a look to see who's the insurance provider. Will they cover this test? Will they cover this treatment? Do I have to rethink my plan of care because of this? I don't want to have someone from the office call them back later and say, remember that medication we said we were going to start for you? We have to actually start with a different one. No, it's not what Dr. Lynch wanted to start with, but it's what your insurance is telling us we need to start with. We got to start with this one first. Then am I able to know that my patient understands what medication they're starting? Have I had the opportunity to discuss that plan with them directly? Have I been able to see that they're knowledgeable of what I think is going to happen next? And do they trust that they're really on the right treatment, or that they're really getting the right, the right thing, that if they trust me, that they trust that I wanted to begin with? No, because they heard me say something else first. Or they heard me say, I want to try to get this procedure for you, or I would like to get this study for you, but we'll have to run it through insurance first and see if it works. And I am one of the biggest proponents. I will pick up the phone and I will call for my patient on my own, and I will fight. We have amazing case management. They work incredibly hard, but if it comes down to it and it's like that last resort, I'll pick up, I'll write a letter, I'll do whatever it takes, but I would much rather see another patient, or spend 5 more minutes with that patient, or 15 more minutes. I'm sure you're all aware that we have an amazing simulation center here where we teach tons of things. We get to bring in simulated patients and teach our students and our residents about taking care of patients, being compassionate, having difficult conversations, We talk about delivering high-value care, not ordering things that we shouldn't order, being conscientious about how we provide care. We've actually created and been teaching for probably the last 7-8 years a module on how we identify when patients are declining care because they're afraid that it won't be covered and it'll cost them too much money because it won't be covered by their insurance. I can't tell you how much I would love to retire that teaching module and be able to talk about other things and teach much more about the science of medicine and the compassion of our conversations with our patients. Our parents too. It leads me to my mom, who's constantly saying, what do people do when they don't understand? What do people do when they don't have a daughter who's a doctor that they can call and talk to? This is an act that's going to help our patients. It truly will empower them, and it will allow us to have better conversations and different conversations with them. I am so excited. I am so thrilled. And I thank you for the opportunity today to get to tell you how I think this is going to impact my practice for my patients in the future, and what I get to teach future physicians and how they'll get to interact with patients in the future. This is going to be a win for healthcare. We need this for our patients. And at this time, I would like to introduce Ms. Nicole Robinson from OSF.
Good afternoon. I'm Nicole Robinson, the Vice President over the Access team. This team is directly responsible for obtaining prior authorizations here at OSF. Prior authorizations started out as a way to direct and navigate patient care, but now have become labor and resource intensive for clinicians and can also delay or even block access for patients that need care. Unfortunately, the current process for pre-authorizations harms our patients, especially those in need of immediate mental health or crisis care. We are happy that the Governor and the General Assembly have taken the time to address this urgent issue, which creates a large administrative burden for healthcare professionals, causes frustration with patients and providers, and ultimately delays patient care. Providers must clear certain medications, drugs, and procedures with insurance companies before they can help their patients. Insurance companies are not always forthcoming with what is required in order for a provider to secure prior authorization and then to be able to begin to administer the treatment plan the clinician sees as beneficial and medically necessary. It is very difficult to get insurance companies to pay for certain types of care. Providers must have a large team of financial clearance staff attempting to obtain prior authorizations before treatment can occur. Additionally, the payer websites are frequently down, not working, and do not contain the accurate information we need to obtain those authorizations. The financial clearance team must then sit on hold for hours each day attempting to reach a live person at the insurance company in order to determine what medical records need to be resent if a peer-to-peer needs to occur, or what exactly is necessary in order for the patient to receive the physician-ordered care. Many times, the insurance company steps over the physician's decision-making process and requires what the insurance company feels should be the correct course of action for the patient's medical care. Many times, the provider will need to step away from actually providing patient care in order to speak directly to the insurance company through the peer-to-peer process and justify why they feel that the care is the correct course and medically required. Scheduling and participating in these peer-to-peer conversations is burdensome to administrative staff as well as the already overscheduled providers. This time can be better spent providing care to patients and instead is spent justifying care that the provider knows is needed. Providers are often put in the difficult and uncomfortable position of having a conversation with a patient, telling them that the treatment they know is necessary must be delayed due to this burdensome pre-authorization process. As a healthcare professional, I am in support of the Healthcare Protection Act and call on the General Assembly to pass this bill as quickly as possible. Patients just can't afford to wait for this. And I'd like to introduce Lieutenant Governor Stratton.
Hello, everyone. I am Lieutenant Governor Juliana Stratton. Thank you for joining us. Leader Kaler, Leader Spain, Representative Howder, it's so great to be back here in Peoria and here at this beautiful OSF Cancer Institute. I'd like to start by thanking Governor Pritzker for continuing to prove that strong leadership doesn't have to sacrifice compassion. I also want to thank Representative Mueller and Senator Peters for fiercely leading the charge to advance this life-changing and bipartisan bill through the General Assembly. Though America is struggling with division, we are united by at least one thing: a collective fear about skyrocketing cost of health care. In 2022, a little more than 65% of Americans reported having private health insurance coverage. But having insurance doesn't guarantee that coverage will, in fact, cover you when you need it the most. Due to loopholes, sneaky coding, and sometimes just plain bad acting, it's hard to find many people who feel confident that their insurance provider has their best interest at heart. The work we are uplifting today marks the beginning of a new narrative in Illinois. The Health Care Protection Act interrupts the status quo of predatory practices and instead returns power to patients and their doctors. This is not just a matter of access, though. It's also a matter of equity. A 2022 study of cancer patients found that Black patients were 3 times more likely to have been denied health insurance because of their diagnosis than white patients. We cannot allow any system to function in a way that deliberately leaves people out. And I'm grateful for the dedicated healthcare professionals like those who are here in this room today, standing with us in this fight. Every single person deserves care without adding stress about whether or not a faceless analyst at an insurance company will deem their doctor's prescribed treatment necessary. Let it be known that Illinois doesn't give up. We hear our people's pain, and we see the gaps that allow that pain to persist, and we will do everything in our power to deliver relief. We are quite literally laying down the law with private providers, and I am beyond grateful to be a part of an administration that values humanity and health over profit. Senator Peters, we believe in you. We're going to get this done. Thank you, everyone, for being here. And with that, I'm going to bring the governor back up to answer questions from the media. Governor?
Thank you. Happy to take questions.
Senator Peters, do you have a timeline on when this will be brought up in the Senate and a vote possibly?
It just came over from the House, and it's in assignments. But, you know, this should have been done yesterday, so hopefully as soon as possible. But we just got it over, and when it comes out of assignments, we'll go from there.
No timeline yet on when a vote would actually happen?
In May. No, I'm joking.
Yeah. Well, the whole idea is that the insurance is going to cover the thing that you previously were looking for prior authorization for. So, I mean, we believe that this is going to get people treatment faster. It's going to make sure, actually, it'll be less expensive, because think about all of the iterations that we just heard that doctors go through before they can actually treat their patients the way they know they should be. And so we believe the holistic view of the way we're managing prior authorizations is much better than what it has been historically. I heard Representative Spain on the floor of the House when they were passing it in a bipartisan fashion with his support say something that I always think about, an important change that we're making in the law, which is we're probably going to make tweaks to this law over time. There no doubt are things that we'll discover, need a little bit of work. But this law, as it is today, will make an enormous difference in people's lives. And I believe, prior authorization, at least, we're not banning all prior authorizations, but we are saying that in many circumstances, we want to make sure that the standard that's being used here is a standard that the doctor, their physician, is setting. Yes, ma'am.
How do you anticipate the impact of the accessibility and affordability of health insurance, especially for
Well, I think one thing is just banning these, I'll start with these junk insurance policies. People don't know. I mean, if you're out looking for insurance for your small business or for yourself, and you don't know that these scams exist, just saving people from being exposed to those exams and I mean to those scams rather, and making sure that they know that there are quality health care providers out there and health insurance coverage that isn't a scam, I think is one way in which we're going to save people time and money. I think the last part, I think you were just generally asking about saving money in the system. As I said before, one of the things that impedes the system working properly and therefore costs more is the steps that you have to go through to finally get the actual treatment that you need. So think about having to go through step therapy, having to go through failing at one kind of treatment before you can get to the treatment that actually will work. How much time, how much of your health care is wasted, literally your health is wasted by that? How much money is wasted in that process? If we can do away with that, I mean, we genuinely will bring down the overall cost of health care and therefore the overall cost of health insurance. Yeah. Well, remember that we're talking about a building that genuinely needs to be either replaced or rebuilt. And so at the moment, there are going to be hearings for both of those locations. That's the process that we will go through to make sure that everybody's voices are heard. But I want to be clear that there's no chance that we can keep these facilities open as they are for any period of time because they're falling apart. Investment has not been made in our prisons across Illinois for many years, and we have facilities that are over 100 years old. And you can imagine in a modern era when we all believe in rehabilitation, that people should have the ability while they're in prison to learn a trade, perhaps, so when they get out, they don't end up recidivating. They do end up getting a job because they have a skill. If you're in a facility that was built 100 years ago or 50 or 70 years ago, when people weren't thinking about that, there isn't even room to run those programs. So we believe that upgrading the facilities will make sure that we'll keep people safer in their communities, especially as people serve out their sentences. Yeah.
It was previously mentioned that the doors open for advocates and opponents of this bill and discussions that were craft for you or any of the legislators. How involved have insurance companies been in this process to craft this legislation?
Maybe I'll ask Representative Muller to answer that because she's been fully through that process.
Yes, this bill was drafted and crafted with the input of the insurance industry. We've had several meetings with them to address concerns that they brought, with the initial underlying bill. We know we know that we need insurance companies, and we need to make sure that the provisions in the bill are operational and can be implemented. So, if you look at the original bill that was introduced, and we passed House Floor Amendment number 4 on Thursday, which became the bill, there were changes incorporated based on our conversations with insurance companies. A lot of it was the spirit and intent of the underlying bill is maintained. And quite frankly, we realized, and the insurance industry was pretty upfront with us from the beginning, that there were elements that they would never agree to, including the rate review for large group plans. And that was something that we felt was integral to the legislation and remains. So they're not fully supportive of the legislation because of those types of provisions. But in terms of making sure that when the companies are updating their provider lists under the network adequacy provisions in the bill, that we were outlining steps and timelines for them to meet those mandates that are in the legislation, clarifying and outlining areas when it came to definitions around the formulary and how the step therapy provisions would be outlined. So, you know, we want to make sure that they can, once this bill is passed into law, that they can implement it. But I think even with those discussions, we've been able to maintain the integrity of the underlying bill.
I don't think I've ever used that language, and you can go back and, you know, 6 years, 5.25 years in office, and when I ran. But if I have, forgive if it would be once, perhaps. The truth is that the Trust Act, which is a bill, a law that went into effect before I became governor, signed by the prior governor, is what's in place in Illinois. And essentially, the idea here is that someone who is living here who's been undocumented and may have been here for years, getting pulled over because they were speeding, should not be a reason to now pull somebody out of their car, arrest them, and send them to ICE at the federal level and have them deported. That oftentimes people are living here not just peacefully but productively, and that over time people have applied for and gotten permanent residency or citizenship. We should have a system like that, once again, by the way, that people can apply for, go through a process. And it's not a very good one as it is. We need comprehensive immigration reform. But I believe that that's a law that's been good for Illinois, the Trust Act. Now, one other comment I would make. You know, there's a lot of hysteria that's going around about the fact that we have legal asylum seekers. They have papers, they're here legally in this country while they get a hearing, while they wait for a hearing, and that we're, you know, trying to provide them, those who don't have work authorization, and we're trying to get more work authorizations for them because there are jobs available in Illinois for them. But we're just trying to provide them with some basic humanitarian care. And we've done that, I believe. I've seen the hysteria on Facebook, and gets promoted sometimes, about that busloads of people are being shipped from Chicago to some other place in Illinois. That's not happening. It hasn't happened. It's not going to happen. We are receiving busloads of people from the state of Texas without any prior notice of their arrival, sometimes in the middle of the night. Why do they do that? Because they want to cause chaos. We have managed to rein it in so that it's not chaos. And indeed, our goal here is to help people get to their hearings, to get determined whether they actually can have legal asylum and stay in the United States or be deported by that hearing. But it's our job, I believe, to act in a humanitarian fashion. It's what Illinois, I believe, stands for. It's who we are as Illinoisans, and we will care for them. You know, we believe that comprehensive border security as well as immigration reform will help us manage this in years going forward. But we're going to do everything we can right now. Yep. Thank you.